Okay, so today we're going to start with the female reproductive system. And why do we have more lectures on the female reproductive system? The female reproductive system is way more complex in anatomy and physiology than the male reproductive system. I mean, that's why we have OB/GYNs. We have a whole medical specialty, gynecology, that's devoted to the female reproductive system, whereas men, is there such thing as andrologists? There is a study of male reproductive issues in men called andrology, but there's no official medical specialty that's devoted to andrology. So when men have reproductive issues, we go to urologists for one stop. And again, why? Again, the anatomy of the male reproductive system is relatively easy, and you'll see why in this lecture. All right, so to review, again, we talked about gonads. So the gonads, the male one is the testes, the female one is the ovary, or are the ovaries. And the sex cells that are produced by men, they are the sperm. And then in women, you have the eggs or ova. Now hormones, so men, they have one primary category of hormones, and the most dominant one, or actually the primary male androgen is testosterone, whereas in women, they actually have two primary sex steroid hormones. So estrogens is a category, and estradiol is the most powerful one, and then progestogens. And the most powerful of them, or the primary progestogen, is progesterone. So those are the two main ones. So again, already the women have two hormones over just one general category for guys. All right, external genitalia, and it's pretty simple. I mean, look at this. Again, this is external genitalia. This is what you can see from the surface level, whereas in women, the mons pubis, pubic mound, aka mons venus. And then you have the clitoris, and then the urethra, and the vagina. The labia majora and minora. So what we have here, again, the urinary bladder is anterior and toward the front, whereas the uterus, this sits behind and a little and superior to the urinary bladder. So again, during pregnancy, this is why pregnant women often experience incontinence in their urinary control. Why? Well, if you have all the pressure from the baby, this is going to cause increased pressure here. Again, not the same passageway. The urinary bladder has its urethra, whereas the vagina is the passageway that links the uterus to the external environment. Okay, so say you're done using the restroom, and what do you do after? Well, you want to clean up, right? So which way should you wipe after using the toilet? Should you go front to back? Or should you go back to front? Now, ergonomically, it's easier just to reach down and pull toward back to front. But why should you actually wipe front to back? Well, look at this way. So now we have another view. Now we're looking from the inferior view of the genitalia. So again, here's our clitoris, and that's the prepuce or the clitoral hood. And then we have our urethra, and then we have the vagina. And then say you're using the restroom and you're done with defecating. Well, this is the anus. So which way should you wipe? Well, if you wipe from back to front, what happens is that, remember, you have all that gut bacteria. So if you do that and wipe that from posterior to anterior, guess what comes along for the ride? Yeah, and look where it can end up. So you're taking all the bacteria from here if you wipe from back to front, and you can actually have it end up in here and here. So again, the kind of infections of GI gut bacteria in both the vagina and the urethra. So again, this is why you should actually wipe from front to back, anterior to posterior. You go from clean to dirty. Again, this is why, even though it's easier to wipe from back to front, this is why you shouldn't do that. So what about guys? Are we at risk for these type of reproductive and urinary infections? Well, think of it this way. If you did use that same technique, how would you be able to actually infect your urethra right here? Well, you would have to somehow do this and somehow travel all the way from back there and somehow wipe it up here. So this is why guys are less likely to get UTIs or urinary tract infections from bacteria back here, because again, you have to pretty much go out of your way to infect yourself that way. Okay, now we know why you should wipe from, again, front to back, clean to dirty. But Who is more at risk of bladder infections? Well, again, what we have to look, where is the bladder? So in women, it's and men versus men. In women, it's over here, and men, it's over there. Now you have the same opening, you have an external urethral orifice in both women and men, but look at this. Look at the path the urine takes as it goes from the bladder to the external urethral orifice. And say these two individuals, they were kind of dirty and they did wipe from back to front, and they've brought some of the GI bacteria up toward their external urethral orifice. Now, who's going to reach the bladder first, assuming the bacteria travel at the same rate? Let's do a little race. Yeah, so you see in women, due to the shorter distance between the external urethral orifice and the bladder, this is why women are more prone to bladder infections. If any of these bacteria that are pathogenic and then can cause infections, they have a shorter distance to travel. Whereas in men, yes, you can get UTIs, but to actually get bladder infections, they have to travel all the way up here and into the bladder. So just by pure distance and anatomy, this is why women are more prone to UTIs and bladder infections. And yes, what you see here is that the most common type of bladder urinary tract infections, or UTI, is from E. coli, which is a gut bacteria. So this is the most commonly isolated from these infections, most common cause. So again, E. coli is abundant. It's a species of bacteria that's abundant in your gut and your feces. And again, this is why it's important, that direction. This is why you have to wipe from anterior to posterior, front to back. Even though it's a little more awkward, you don't want these UTIs. So again, E. coli is the most common cause of